Praise the Lord, my viewer. I want to believe that you've had a wonderful week. And peradventure, if your week did not go as you expected, we know that God is together with us even this coming week. What a wonderful opportunity to come to your homes again this evening to grow. Like I've always said, when we stop growing, we start dying. Last week, we discussed about family planning. Right now, we're going to discuss about how best can we support pregnant women during this season of COVID-19. And how can a pregnant woman take care of herself best during this season? Children are part of our family, and a family is part of a community. A community is part of a nation, and a nation is part of the world. When we say that children are part of a family, we truly understand that their families, a husband and a wife, that have not yet been blessed by children. Does that make up a family? Yes, it makes up a family. And we want to pray that the Lord will bless you with children, because He says that this is the reward of your womb. And today, I have wonderful women of God with me, and you met them last Sunday. They are not new to us. Both of them, they are midwives. How these two women got into midwifery is something that I cannot tell. And we want to know your story. How did you choose to get into midwifery, the two of you?
I think I'll start.
Okay.
Hello, viewers. Nice to be here once again.
Yes.
Yes. Shifra is a Bible name, and it is in the book of Exodus.
Yes.
And if you've read the story of Moses, you will find two midwives there that were ordered by the Pharaoh by then to kill the Egyptians, the Hebrew women's children. And then these two beautiful midwives refused to do what the king said, and told him, you know, when we get there, by the time we get there, those people have already pushed their babies and they are already on the ground, so we cannot kill a live baby.
Yes.
And when my father chose that name and told me when I was very young, I felt like that is something interesting. I think I can be a midwife. And then I continued thinking I can. And then, unfortunately or fortunately, I got a back problem when I was in my P7, primary 7, actually primary 6, back in primary school. And my orthopedic surgeon told me in my senior 5, I'm Ugandan, so we have senior 5 over there.
Okay, okay.
Yes,
that's in high school?
Yes, high school. And they told me, you know, with the way your back is, you can never have children. And then I'm like, you don't mean what you're saying, because I love babies. I love babies so much, so how can I not have babies? And then trying to accept it, I said, well, I had the vision of becoming a midwife. And since this is what they're telling me, if I can't have my own child, let me help that other woman have their own child.
Wow.
Yes.
Turning your adversity into advantage.
Yes.
You chose that, if this happens to me, I want to go into midwifery to support
another woman.
Yes. Wow.
And it is something very beautiful to see that smile and that cry of a baby coming out of the mother's womb. It's joy.
It's joy.
Yes.
Wonderful. I can see passion in your eyes, and it's written all over your face. God bless you. And your name, Shifra.
Yes.
Wonderful. Wonderful.
I think I have come to believe that names make us.
Yes.
Yes,
names are powerful.
Make us. Yeah, so
wow.
When you choose the name for that baby, think about it. Names actually make us.
Wow.
It made me.
It made you.
Yes.
Do you have a name for the baby yet? Good. Wonderful. What about you, Mrs. Mbote? What inspired you to get into midwifery?
Hello, viewers. I started off as a plain nurse. During our time, we were doing nursing 3 years. If you need to specialize, you go back to school another 1 year. So I started off as a nurse.
Okay.
And our facility is a big facility. So sometimes you take charge of the facility.
Oh.
So if you are not midwife, you get challenges to solve some of these issues.
Yeah. And you rise up to the occasion.
You have junior personnel under you, and you have to make decisions that are appropriate at that particular time. So at one particular time, there was a problem that I was not able to solve. And my senior wondered why I could not solve that problem. And he asked me whether I'm a midwife. I told him no, I'm just a plain nurse. He said, you need to do midwifery, it's good. No, midwifery is very difficult. I don't like it's very challenging. You need to put your time there. You need to put your brains there. I don't want to getting stressed with issues. So I don't want something that will stress my mind. I just want to do my nursing that I'm used to. But he said, no, if you do it midwifery, you'll be happy.
Okay.
And he encouraged me.
Wonderful.
He booked an interview for me to go and do midwifery. So I went and did the interview. I passed, and I took the midwifery as a post-diploma course, Pumwani maternity, 1 year.
Okay.
And I've liked midwifery.
Wow.
It's very interesting. It's very satisfying.
You
are not complete as a nurse if you are not a midwife. So when you do midwifery, you are able to solve many other problems, even at the community level.
They call them the small doctors.
Yes.
But I think we are the big doctors.
Yeah. The big doctors, especially you are the ones that are involved in like starting life. Yeah. Bringing forth life. Oh, God bless you. God bless you. One day when you're doing that, please call me. I would want to witness, but I don't know if I have the grace to stand there and watch. Maybe I'll be crying and doing all those things. But God bless you. You are doing a wonderful job. May the Lord bless you. Now let me ask you, ladies, is it safe for women to conceive during this time of COVID-19?
Is it safe, Safira?
Well, conception is a personal choice, and it is something that we cannot force into somebody's mind.
Yeah.
I think when I got pregnant, I did not personally say I want to get pregnant now. Now, there are those pregnancies that come that way, and then there are those people that actually have planned. I am planning to get my first baby in 2020. Yes. And here is 2020 with COVID-19. Yes. What do I do? Well, research has showed that there is no evidence that COVID-19 compromises pregnancy. Okay. So it is as well as good as far as if you had decided and you feel like you are right to have a baby at this time, then go ahead, because I mean, we always say a pregnant mother is not a sick mother. Yeah. Even when they come to hospital, they are never sick. That is why we have to make sure they go back safely, because they do not come in as patients. So we are not that vulnerable. However, we have an allowance of the vulnerable group because of the low immunity that comes with pregnancy. So if we can contain that and boost our immunity during this time, and why not have a baby?
Why not have a baby during COVID-19 season? Wow. Mrs. Mbote, what are some of the guidelines that a pregnant woman should observe during, if you find yourself pregnant? What are some of the things that Shifra needs to do right now to
like
keep herself safe?
Yeah, like she says, pregnancy brings your immunity down.
Yes.
So you need to follow the guidelines that have been put by the government. That is hand washing. With hand washing, you eliminate a lot of illnesses, not just COVID. Even the common cold, if you observe right now, the common cold is low. This is the season we usually have a lot of common colds, a lot of pneumonias for children. But if you look around, it's down.
Now I understand.
So
now I understand.
Wash your hands regularly, just as it. Don't get tired. You move from the market to the supermarket. Wash your hands all over. It will prevent some of these conditions that might bring problems to pregnant mother. Use your mask if you have to go out. If it's a must that you go out, and especially when you're coming to the clinic, use your mask and try to keep social distancing. All these hii mikakati imewekwa na serikali, they are good enough. They'll prevent infections for the pregnant mother. They'll prevent infection to us as health providers, and we'll be able to take care of the pregnant mothers. With low immunity, with the pregnancy, you need a balanced diet. It's available, though it might be a challenge, but just go for cheap, available foods that are there in the community. Vegetables are available. We have all types of foods. Don't go for the... We have omena. With 10 shillings, you can get omena. You have your proteins. We have the small piece of gari that is available, so that you have a balanced diet, and you'll be able to take care of yourself. Yes.
You mentioned about social distancing at this particular time, and you like pregnant mothers, there are some that need to go outside and maybe buy groceries and maybe do shopping for their newborn babies. Yes, unborn babies. So what will happen in such cases?
Well, I think all of us live, we are not islands. We have a support system. We have our families, we have our husbands. And those are the people that should be going out to bring these things to us. It is as easy as telling your husband, nataka dania na nataka ya green. So he will go there and bring that green dania. You know,
do you have a craving for dania?
Obviously.
That's why you mentioned that.
So those cravings that ladies have, and during this time, they are so exposed to this COVID-19. If you can, step in as a husband. We need the males to get involved in our pregnancies. Taking part of this period, especially now, will do us a great deal. Yes. So let them go out there, bring us what we need, and then life goes on as normal as possible.
Wonderful. Mrs. Mbote, what do you have to say about social distancing and groceries and shopping? And women can be shopaholics, especially during they want everything for their children, even things they don't need. They buy, then they later realize, I didn't need this. What do you need? Would you say about social distancing at this particular time for pregnant women?
It's very necessary to maintain that social distances. But there are times you need to go out. During that time, we are being told the mask can prevent you. Use it. And spend wakati kidogo sana ukiwa huko nje. Don't go to in, out. Just go to specific places. If you want to go to the supermarket, go to the supermarket, pick what you want, return home. Yes, if you have people to help you, like she says, it would be good so that we avoid the movements around. Everybody is prone to get this disease. And for a pregnant mother,
chances are higher.
Chances are higher. It is worse because we don't know how the COVID-19 will affect a pregnant mother. So far, sijaona mwenye wamepata, and I would not want. If you are coming to the clinic, just come straight to the clinic. We'll help you put the social distances because we are also prone to the disease. We'll aid you, we'll give you the services, and you'll go. If you usually go to the clinic at Nakuru level 5, all where you have to use the matatus, avoid that. There is a clinic nearby where you can walk, go get your services there, and go home. Hatuna mpaka ati wewe umekuwa ukienda hii hospitali usikuje hapa. It is your choice. So if you can now lower down to where you are, the nearest clinic there, it will be safe for you.
You heard that? If you can go to the nearest clinic, the better for you. If you can delegate as a pregnant mother, delegate, call a friend and say, hi, please get me some groceries. Please, why don't you do this? That's one of the ways that they're saying we can support you. You don't have to go through this alone. This is the Virtuous Woman. We are taking a very short break. We will be back after this. And when we come back, we will look at, is my child vulnerable to COVID-19? Can COVID-19 bring some defects on the unborn baby? We will look into that. God bless you. Keep tracking with us.